My name is Joshua Marcus. I'm a board-certified neurosurgeon here at Elite Brain and Spine of Connecticut. My specialties include minimally invasive spine surgery of the lumbar and cervical spines, as well as blood vessel disorders such as brain aneurysms and stroke. Spinal stenosis is a pretty broad term. It really means narrowing of the space where the nerves are living. So sometimes that stenosis is in the center of the spinal canal, where the nerves are kind of traveling down the tube of the spinal canal. And sometimes it's where the nerves are exiting. That exiting point is called the foramen, which is a fancy word for a hole where the nerve is exiting out of the spine. And you have foramina in your neck and your cervical spine, you have foramina in your lumbar spine, and stenosis can occur at either of those points. Very often stenosis in the mid portion of the spine or down the tube will cause pain into the back, the buttocks, down the legs. We call that claudication. It's basically pain where patients are standing and walking and there's more pressure on the spine at that point in time. This can be quite debilitating. Right? Patients often sit down, their symptoms get better. Sometimes they even find that they're sort of flexing themselves forward, which kind of effectively opens up the spinal canal. And we call that a shopping cart sign, right? I get better in the supermarket when I'm leaning against a shopping cart. I get better if I lean myself forward. I had a patient tell me recently, every time I have to cough or sneeze, I lean myself forward, and that sort of gets me through that process without severe pain. So stenosis symptoms can be pretty debilitating because they can really limit your ability to function. Right? They can limit your ability to walk and stand and exercise and even work. Spinal stenosis surgery is often performed through something called a laminectomy. So often we want to drill away the bone and take off the ligament that is pushing on the nerves to give the nerves more room to breathe. Almost all of our neurosurgical procedures are really meant to give a structure more room to breathe, whether it be a nerve in particular, the spinal canal, the spinal cord as it relates to cervical or thoracic surgery at times. And a laminectomy can be often performed through a small incision. We often use minimally invasive techniques. We can dilate through the muscles with a series of tubes rather than having to traditionally take the muscle off of the spine to see everything we're working through. We work through a microscope to take off just those structures that are putting pressure on the nerves, particularly the joint overgrowth and the ligament overgrowth. And often patients can go home, same day, next day. And again, those spinal stenosis symptoms can get better pretty quickly. A fusion is a bigger operation where patients need some type of hardware placed, whether that be screws or spacers. Again, there are a lot of different corridors where we can place those screws or spacers. And with our use of robotics and minimally invasive approaches, our team at Elite Brain and Spine is really employing the least invasive approaches to spinal surgery available. And oftentimes, that does not involve placement of any hardware, but sometimes it does. And hardware placement is really dictated by stability, how much of the normal anatomy of your spine is left. And if it's not enough to support the spine, we have to replace it with something. And sometimes that's screws or spacers, and we're hoping that the bones fuse or grow together over time. TOPS is a alternative procedure. We have now newer procedures where rather than a fusion, we can preserve that mobility and not impart any additional stress to the other levels of the spine. And we are really the only center around performing this procedure, which is new and exciting for our patients. Once again, I'm Dr. Joshua Marcus. If you or a loved one are experiencing any of the symptoms we spoke about, please feel free to reach out to Elite Brain and Spine. We are happy to help.